Доброго дня, шановні колеги. Ми день і зараз будемо говорити.
We're going to continue our work. We're going to talk about the non-freedom in the ATO zone, what the non-preventive mechanism presents so there. We are going to talk with the Tetiana Pechonchyk, the chairman of the board of Human Rights International Center, Oleksandr Gatiyatullin, expert of Department of Advocacy, Yuriy Belousov. Again, we are talking about the national preventive mechanism representative here. You have the floor, esteemed colleagues. Good afternoon, esteemed colleagues. We are going to start our briefing. My name is Tetiana. Pechonchyk, our moderator, has introduced ourselves. We are going to talk about this following topic, which we take care of for a number of months now, this lack of freedom in the ATO zone. And starting to talk on this specific topic, I would like to say that we had a lot of different discussion regarding the hostages and the liberation of hostages, but we did not talk much about those people who become the hostages to the square, and we refer there not only the penitentiary system, let's say facilities, but those facilities where the person is let's say taken off by the government, let's say the special spouse or the hostages, etc. And we are talking about those facilities which cannot be left by the persons, and they are, let's say, they are taken care of by the state. When we are talking about the lack of freedom in the ATO zone, I would like to subdivide that into two big sub-problems. The situation of those lack of freedom places which are located on the occupied territories of the Donetsk and Lugansk regions, and unfortunately there we cannot provide any kind of or take any kind of the trustworthy information because we do not have let's say ready access. It's limited or restricted, and the majority of those facilities are in the ATO zone. I'm talking about those facilities situated on the controlled by Ukraine territory, and in fact we can say that this is a kind of frontline zone facilities, and also there are a lot of problems specifically there, and we are going to talk a lot about that, myself and my colleagues. And one of the biggest problems, in my opinion, is the fact that the efficient or timely evacuation of people hasn't been provided. There I'm talking about the facilities located on the occupied territories. Some of those were evacuated completely, some of those partially, and some just remained absolutely untaken or unattended to. And there are some small piece of information about the Golovsky disabled children facility, and we had some information they tried to evacuate children from there, but there are some severe cases who could not walk, and they were actually bedridden, and we had the information that only 5 persons of the number of those survived. There is no medical assistance. There is no subsistence for those people, and we could talk more expertly on those people. And we had some monitoring missions in those lack of freedom facilities located on the Ukraine-controlled territory. The problems which we registered, I can talk about the major ones of them. One of the most important problem is lack of coordination between different ministries and departments regarding the situation per se available in those facilities, and the lack of the let's say of the single approach. What has one to do when there is kind of aggravation situation, when we cannot prevent the further aggravation situation with the violation of human rights. For example, we are talking about the facility subordinated to local authorities, and accordingly this makes a very complex issue of the evacuation. Evacuation takes place, it takes place within the boundaries of one region, and we registered some of the cases when some of those people were evacuated from the conflict zone to the frontline zone, to some other facilities. But when the front line moved closer to that area, and we were afraid that those facilities could be the target of shelling. For example, one facility where we visited, we could hear the blasts and the explosions of shells or rockets, but those facilities continue to operate. Another problem is the fact that not everybody was prepared for the escalation of the conflict, to the combat actions. Even the basements were not prepared for let's say, the hiding places or hideouts for the people. And unfortunately, not everybody were ready for such situation. Another problem of the lack of freedom facilities is the populated areas. We're talking about Slavyansk psychoneurological facility, which is overcrowded, almost twofold. I mean, there were 600 persons, which is twice as many as could be accommodated with that facility, and it was clear that under the condition of this force majeure, we had to do something, but we could not do that for a long period of time. Actually, there was no aisle between different beds. You cannot pass between the beds. And another problem which we registered is the lack or the absence of the psychological assistance to those people who were evacuated from other facilities or hospitals. And this is only a few of the problems which we registered. Now I would like to give the mic to my colleagues who are going to talk not only about the social sphere facilities, but they are going to talk about the penitentiary system and what we have to do with all that, Good afternoon, Andriy Chernousov. I represent here public organization monitoring.
Independent monitors. We're trying to follow the situation taking place in the places of detention, and we have recently finished the so-called phone survey in the detention facilities which are in so-called republics. We called to 141 of such places which are on the territory which is not under the control of Ukraine. Unfortunately, only 24 institutions replied. The rest of them are either evacuated and closed, or the communication is broken with them, or they tell us they are not part of Ukraine and they will not provide the information to people who call from Ukraine. We need to mention that they refer us to so-called ministries to get information from them, of so-called, I don't know. They are forming the authorities. They have the Ministry of Public Health, the Ministry of Social Policy, the Ministry of Education, each one of these republics. And they have subordinated these institutions to these ministries, and they believe that they are part of the system that is being created there. But the issue is, it's late for us to talk about evacuation. The time has passed, but there are problems which could be addressed, or at least we need to try to address them. There's no secret that now many international organizations are working, Medicines for something. They are ready to help. They work on both sides of the conflict in the air. Schools, boarding institutions, the detention facilities, and so on. There are children, there are people left, and to assess how many exactly is impossible, but approximately 4,000 or 5,000 people who require assistance, and we've made the list of needs that are there. We have submitted that to the World Health Organization, which is here with the mission, and they are developing the plan of assistance. This happened not yesterday, not with the beginning of the conflict. The situation in such institutions was bad even before. They were not sufficiently financed, and after the beginning of the conflict, the situation has complicated, has become even worse. First of all, the qualified personnel left. The doctors, medical nurses, all those who could, they left these places. Second, this lack of funding for primary needs, food. People have nothing to eat, and almost 80% of those who are there, those who are in remote areas, and they informed us that they have nothing to eat. They need any type of food, cereals, flour, whatever you can. Please send us. Then medicines. People there are with chronic diseases, and that's psychiatric hospitals. They require permanent medical assistance. They have no medicines there, and they are not supplied to this area. Even when they say, when they say whether they support Ukraine or DNR, I believe that most of them do not support anyone. The only question they have is how to survive till tomorrow. And the fourth or the fifth is an issue of equipment. You've seen the shower rooms and the toilets. In many, the communications are broken, and they supply water during certain hours. I would like to explain that people in these boarding hospitals, institutions, people who are not mobile, they cannot move without assistance, they need to be helped in anything, and the water is supplied during several hours, or in some cases only during several days. And they all ask for some containers for water, some pumping units for water, for collecting water. Also, I would like to mention that in order to react to this situation, we need to start change the system of such facilities. And for us, it's a very expensive lesson. We need to examine it and to draw conclusions. We concentrate attention and will be demanding from the state that they shouldn't treat the citizens like that, because they all are citizens of Ukraine. They all require assistance, additional assistance, so that it does not happen in pre-front territories. For that, we need to create the system of a warn, the system of warning, the system of communication, when every client of such institution has a place further away from the front line, not Donetsk, not Lugansk, not Kharkiv and Dnipropetrovsk regions, because there are so many people there already. There were 152,000 officially registered as of Monday, but we believe that there are 3 times more of them. There are dozens of thousands of people with special needs and disabilities. If we say, well, talking about children institutions in Ukraine, all the institutions are filled only 50%. We can move children easily from all the territory of Lugansk and Donetsk Oblast, and we can move them to safe places. Thank you. I'm Oleksandr Gatiyatullin. I am the monitor of the national preventive mechanism. I also work in All-Ukrainian network of people living with HIV. I was in 3 monitoring visits, Artyomovsk, Mariupol, and detention facilities, and Kramatorsk orphanage. Because of the specific nature of my organization, we started to look at the problem of we started looking at this problem in summer last year in all these penitentiary institutions, because our organization supplies medicines for HIV positive people to the detention facilities.
The territories of Lugansk and Donetsk region, there were 36 facilities of the public penitentiary service. Today, only 7 of those, of that number, are subordinated to the state penitentiary system. The rest, last year in the summer, they switched over to the subordination to the so-called the state penitentiary service of the LPR or DPR. The people, and we are talking about more than 20,000 convicts, they remain there. 500 persons of those, they receive antiviral treatment, are subject and undergo this treatment, and we managed to do that and to ensure that they are provided this treatment. We could not leave them without that kind of treatment. And the public penitentiary service, since the summer of that last year, they actually rejected or they refused to provide medication there. And we are talking about not about those public facilities subordinated to the government of Ukraine, but those which report to the penitentiary system. We visited their Tomsk detention center, and we know how those medications were getting through to that place. Now, the local people themselves were delivering those medications to such facilities. Again, on our own, we ourselves actually deliver those medications to the territory not controlled by the government of Ukraine. So Andriy actually raised the issue of evacuation. It's too late to evacuate those people now, but in those days, in May and June, there were all the necessary conditions, prerequisites for evacuation. The penitentiary facilities annually they redesigned the evacuation plans. They had those plans. There was also the instruction on the part of the head of the penitentiary, public penitentiary service in June last year to start the evacuation from those areas. But in addition to that instruction, there were no actions taken. But this kind of comprehensive process. We had to coordinate that effort with the railroad, with National Guards, with ATO forces to coordinate this plan, which specific facility is going to evacuate it where. But this didn't happen. And now we have the situation, what we have. We have what we have, as we say. We are talking about the national preventive mechanism. At the day of our visit in Artyomovsk, actually, over the 8 last months, there were no evacuation, state-by-state evacuation from that facility. They were convicted already. They were staying in that facility. They had to be moved to the places where they had to serve their sentences. Some of them suffered from TB, and they had to be sent to a specialized TB, penitentiary facility. There were also the problem of convoying those persons to the place of the service of sentences, where they had to serve the sentences. And again, on the periodical, the court has to extend the term they have to serve. In that context, the persons were not actually convoyed. They actually proposed to hold a video press conference, but they rejected that. And according to the Article 20 of the law of the preliminary detention, they had to actually to set those people free. They were liberated. Maybe Alexander Frederick will talk in more detail about that. So that was a kind of the whole complex of the problems we encountered there. So what we have to do further on, in my organization for the people living with the HIV, we continue to assist those who provide the medical aid, provide medication to those people who stay in territory non-controlled by the Ukrainian government. We understand that those people need those medications badly. So try to arrange the next humanitarian convoy carrying those medications, which are badly needed to that people. Elena Timchenko, deputy head of the National Preventive Mechanism Organization, and in the office of the Ombudsman of Ukraine. We actually take care of this function of national preventive mechanism in accordance with the alterations and modifications introduced to the national legislation. I represent this national preventive mechanism organization, and we are talking about those people who have been convicted or, let's say, imprisoned. We are talking about 20 in the Donetsk region facilities and 7 in Lugansk region. We are talking about the regular telephone polling of the, let's say, of the management of those personnel working in those penitentiary facilities, both located on the temporarily uncontrolled by the Ukrainian government and other establishments or facilities in those regions. The ongoing monitoring of the mass media and communication with volunteers who try to provide the aid to those facilities. I would like to say that for the first time ever, let's say the ombudsman representative last May tried to do something about the let's say lack or some kind of interruption of water supply or power supply, but even almost 1 year ago there were some requests to the government regarding the possibility of evacuation. All in all, those requests number exceeds 20. Unfortunately, for the reasons which have been mentioned already, we are talking about a number of facilities which remained on the territories uncontrolled by Ukraine. Out of 73 the hospitals, we are talking about the boarding facilities or hostels. The majority of them, 39, are still located on uncontrolled by Ukraine territories. We are talking about the disabled persons. A lot of them still stay on that territory. Andriy told you that not always they agree to contact us, and there are some of the managers who try to do anything possible to prevent those contacts, and we try to do everything possible to deliver neuroleptics or, let's say, the different napkins and pampers, whatever else. But because of the lack of this system or absence of this system to provide the aid, not aid, but to ensure the non-violation of the rights of those people who remain on those territories, but we do not have that opportunity or the levers how to do that. This became the result. This resulted from the lack or the absence of the plan, untimely response, lack of the correlation of the actions of different ministries and departments. And Alexander attended the meeting when the Minister of Health has a huge opportunity to provide the medication assistance, but they do not know that there is a bad need for that in Donbass area. Also, sometimes the ministers do not receive the information about the facilities which are subordinated to the local governance bodies. And what happens if something happens? The local authorities have themselves to take care of those big problems. For example, town of Dzержinsk during our visit there in the beginning of February this year, or more than a month, 70 people, aged persons, disabled persons in the hospitals and state, let's say, they were deprived even of the water supply service. More than a month, and some persons bedridden. And whatever we could take the assistance from volunteers is not enough. Another big problem, and we mentioned already, and we were talking about the evacuation and the place of evacuation. Yes, that happened with much delay, but as we had the answer from the minister that there are no instructions regarding this specific subject matter. But when we already faced the situation when people died, and we have the confirmed information about 2 deaths from the geriatric facilities, 56 children died. We have just the general or the figure for the end of February, but we have the critical situation, abnormal situation, lack of the assistance to be given of the people who stayed on the uncontrolled by Ukraine territory. There, you know, the places or the locations where to evacuate those people, there are, and they do exist, but there is no mechanism how to evacuate those people, because it's really very hard to evacuate or take away those people. You remember what happened under Popasna. They tried to evacuate those people under the conditions of shelling, bombardment. We have to know exactly where to evacuate. We have to know who is going to be responsible for that, what kind of the transportation vehicle will be allocated, etc., etc. And when the minister already issued the instructions just to generate the plan, for example, in the front line, 40 or 50 kilometers, and in 20 kilometers it's away from the front line, etc. But those plans are not in place, which testifies to the fact that the directors do not know when, where, and how they're going to evacuate their people in the case of aggravation of the situation. In addition to that, I'm going to say a few words about systematic problems. Problem of evacuation and bringing back those people to their places.
Счастье.
Such an example, Shastya, the boarding school there, the orphanages, those children who are orphans, they did not return back, but those children who have parents, they returned back and they study with shellings going on. Also, the self-organized institutions in Shastya, for example, there is a hostage for people, or elderly people, and it is supported by volunteers only. No one in the authorities knows about that. The next problem is private. There are few, but we do have private institutions, but they do not react to the challenges either. There was an information about the shelling at such an institution near Stanitsa Luganska, and that was a private geriatric institution. Only after that it was evacuated. Personnel is not interested. They do not provide information. The personnel wants to have job and have funding. So inside one region, sometimes they make some wrong decisions. Slavinsky boarding house was evacuated only thanks to the heroism of the director. But 2 of the institutions where they were evacuated to are on the territories which are not under the control of Ukraine. And I would like to say a few words about personnel and about leadership. Many of them are heroes. They were evacuating their clients, and there's data that some of them were in captivity.
Свої миючі засоби для того, щоб
These are people who brought food from home, And there's a Teplivsky boarding institution which is very close to Stanitsa Lugansk, and people are afraid to bring products there, and every day a person brings food to this place with sharings going on, and all the directors of the institutions were thanking our army that was sharing everything, especially food products, in time when there was no financing. And they also are thankful to volunteers. There's no system, there's no plan for further work. And our national preventive mechanism makes a conclusion. Unfortunately, we react to violations, but we do not prevent any violations of the human rights. And I would like to support the message of Andriy that if there is the situation like that on the territory which is not under Ukrainian control, when there is the situation that there are people there who require special attention and assistance, the state has to communicate with international organizations and provide for the rights of these people. Thank you, colleagues. We are ready to answer your questions. Thank you. Any questions? Please introduce yourselves. First National TV channel. My question is to Olena. How many people from the territories which are under the control are to be evacuated? I cannot quote this figure. We can make such an analysis. But I would like to mention that now we are evacuating. We transported children from Shakhtarsk to Drushkivka. But now there's a plan to take them to Ternopilsky region. We are developing such plans. If you need, I will give you such a figure later. Maybe Andriy knows. I looked at it. We do have data on the territory which is not under our control, 4,000 or 5,000. If we take the total for Donetsk and Lugansk regions, then in peaceful time there were more than 8,000 people like that in social institutions. So if we distract 4.5 or 5,000, 3 or 3.5 are left. We do not know how many of them went away, how many came back. There's migration all the time, back and forth. As soon as sharing stops, people go back. And we cannot monitor that. The situation changes every day. We called them in September, now we called, but it's approximately 3,000. It's not too many. Talking about children, we don't have exact data. We can talk about some institutions. In Kramatorsk, there's an orphanage where there are about 400 children. And this is the front line. And this could become a place for combat. And we have an orphanage with 400 children there. And we need to take them out of that place, and that's the burden on local administrations, on local budgets. But we came back from Ivano-Frankivsk region. They have a wonderful orphanage. They have 30 children there, and they are waiting for children from those areas. I'm from Mariupol, Irina. The situation with evacuation, I know a little bit about it, especially talking about people who for who the state is responsible. These are orphans, the elderly, and people without relatives, or the prisoners. Don't you think that this is a crime, basically? And that is what basically is the crime. I know about the situation which was taking place in summer when Donetsk was, there were children who needed blood transfusion, but there was no blood in Donetsk. It was a problem to supply blood there. Do you do anything in your organization so that the criminal cases are filed? This will be the preventive measure. Some people who are responsible for that, they are to be punished. You cannot just point at each other, the ministry at local authorities, the local authorities at the ministry, and so on. I believe you understood me. Someone has to be put into prison. All of us are representatives of NGOs, just like you. And I believe we do everything we can. We are not special prosecutors. We're not Carlo Del Ponte to take someone and put into prison. Our work is to do analysis. We show, we disseminate this information. We don't have powers to make them responsible, but we demonstrate that at a time when there's the presidential decree and the resolution of the Cabinet of Ministers on evacuation, and that is, I don't know, sabotage, that is not done. And when there is a system of passes that blocks everything, and we know Yevgeny Kaplin, a person we know well, was stopped. They were trying to help evacuate people. Even those initiatives which are there, they're not supported. What can we do to go out into the street? To organize a picket at the General Prosecutor's Office. We do believe that the reports that we write, we submit them to international organizations, OSCE, WHO, UN mission. They all have this information. That's the work that we do and the instrument that we have. We do all we can. Good afternoon, Golos UA.
You said that people are coming back and what they are not happy with. Why do you prefer to go back? Maybe you know something about the organization or the authorities. Why they cannot help those people with those dwellings? Coming back are children who have parents. You have to understand this is the situation as follows. In the summer last year, a lot of children were taken to improve their health and to some place. And when children of those remained in the Odessa region or Nikolaev region or the Transcarpathia, where they were underwent kind of health building treatment, but the parents who remained in the occupied territories, nobody can deprive them of their right to have their children. But we are talking about another situation. When let's say the children from the above boarding schools, let's say, or the orphanages, and I must say that the orphanages in Donetsk and Lugansk region they were way better than those which they have in this region. This is really true. And the children, they just long to come back. They strive to come back to those places they are accustomed to. And unfortunately, some of the children were returned from Odessa to the Kremennoy orphanage. Unfortunately, this is true, and responsible for that are the authorities of the Lugansk region. And your last question? And you're talking about the orphanages or the boarding schools. They approach the local authorities asking for help. How can account that the local authorities do not want to help those? You mentioned that you don't know what number of people who stay in the orphanages or the boarding schools, and the authorities today do not do anything about that. Well, once again, if we are talking about the house of a child or the orphanages, the situation is better with those. We are talking about the children boarding schools. Let's say we are talking about the adolescents or the teenagers, but the small children, little children, were evacuated. When we are talking about the Rovniki and the Krasny Luch, which are not located on uncontrolled by Ukrainian territories. But again, the rest were evacuated, and the situation with the little children is better. But now we are the alarming situation, in our opinion, is what we call the front line of the gray territory. We have to raise hullabaloo now, about that, or try to pinpoint the problem. But they respond to us that the decision is taken based on the assessment of SBU, the security service. But the SBU doesn't provide the information about Dzержinsk, for example, about the threat. Let's say the threat that territory will be occupied, or Victoria, the first independent news channel. What do you think? What kind of action should be taken by the first steps will be taken by the authorities to evacuate those poor children who cannot take care of themselves? I'm talking about evacuation from the territory of LPR or DPR or occupied territory or non-occupied territory. Unfortunately, all the time we are thinking about that, because to us those are still our people. This is maybe my personal moral. This is my personal grief, I would say, but I cannot see the way out. What Andriy mentioned, that they try or attempt to evacuate, and nobody will give them access to do that or allow them to do that. Really, we need a lot of money to provide the, let's say, subsistence to those people. There are some people, sick people, who need special medications or medicine. But we do not know ourselves how to do that, how to take those people away from those territories, because the local authorities who now are there, they do not allow us to get there. Once again, I would like to emphasize that in so-called DPR and LPR republics, they have possibilities to talk to the Médecins du Monde and other international organizations, people in need, the Red Cross, a lot of international organizations who are ready to give them a hand, but we have to somehow to provide access to their, if we are talking about uncontrolled territories. If we are talking about the controlled by Ukraine territories, we have to know number of people, what zones we have to evacuate. Do we have to provide the places they are going to evacuate it to? We do not have to evacuate 20 kilometers from Slaviansk or Svetogorsk. We have to evacuate the people's kind of in-depth evacuation to some territories were situated deeper inland. And again, we have to take care of some kind of the housing fund or the places for the evacuation. The number three problem is resources. If the state had, or now let's say government had this plan, this will be easily assisted by the international organization. We are not talking about the big money. We are talking about the minimum money required for those people to live a normal, more or less normal life. And the directors of some of the boarding schools or orphanages we communicated, they do understand the problem. And they mentioned that the majority of the personnel already left because they were living in the same frontline zone. And they have to leave that territory. And there is another issue, especially talking about chronic persons. They got used to one another. Maybe it would be not that a painful situation for them to move to another territory. And this will allow us to preserve the jobs and attend to the interests of the people.
Based organization Disability Rights International. Це Ерік Меттьюс, він з Вашингтонської організації, міжнародної організації захисту прав людей з інвалідністю.
I understand that in many institutions, staff have evacuated, and I'm wondering if you had visited any institutions any orphanages under the Ministry of Social Policy, where there may be children who are immobile or have more moderate to severe disabilities and are affected by staff not being available to take care of them, and if you're able to provide any further documentation on that situation.
Там же є перекладач, правильно? Ви зрозуміли? А я вже половину прослухала. Ну, Ерік цікавиться більш закладами, що стосуються дітей з інвалідністю і що взагалі там відбувається. Я так зрозуміла, що Олександр був в одному з них, можливо, ви ще й маєте якусь інформацію.
Alexander visited one of them, maybe you have some information. We visited only 23 penitentiary, others are for children, for people with disabilities. But we visited those institutions which are near the front line. This is the territory which is our Ukrainian territory. They are differently prepared, differently financed, but what we saw, the main thing there is what we saw, what is the preparation to possible problems. They know where they can hide during shellings, where they can evacuate people for the time of shellings, but they do not know where to get evacuated, to what territory for longer time. But they continue their regular life, and I would like to say one more thing. We really respect our people because volunteers, we were in one institution and people were saying that they now receive more food than before. That is true. But again, that is on the territory which is under the control of Ukraine. I personally was in Kramatorsk orphanage that is controlled by the government of Ukraine territory. In this orphanage, there are also children with disabilities, including HIV-positive people, and they are with disabilities. What problem I saw? In principle, this orphanage is very good. I mean, the support for people, they have food, they have conditions, Pampers, everything is there. They have different rehabilitation programs and rooms. But the problem I saw, talking about HIV-positive children, there's no coordination in providing continuous treatment, medical treatment for these children. The regional special center is on the territory which is not under the controlled by Ukrainian government territory. They were receiving the medicines from that place, and in Kramatorsk there is no special diagnostic equipment for such children. They had to bring the preparations from Donetsk. Volunteers were doing that. So our visit was about that. There's Ukrainian Center of Control over Social Diseases. The Ministry of Public Health created the system of continuous supply of medicine to these children who have specific diagnosis. It's about HIV-positive children, but there were children with disabilities who needed some specialized examinations, treatment by specialists. In Kramatorsk, they didn't have that. All of that was on the territory of Donetsk. And to provide such specific consultation, diagnostics, that is unfortunately a big problem. the local authorities in Donetsk region on the territory which is under the control of the government of Ukraine does not organize that, does not ensure that. And also talking about children with some rare diseases who are on the territory which is not under Ukrainian control. Because all these medicines were transported via Donetsk and Lugansk, now there's no supply of that. And talking about the current situation, first of all, such children, such people are to be evacuated from the territory of Donetsk and Lugansk regions, because they are to be provided very specialized medical treatment. And the next question. Were the effects of corruption or discrimination registered, and what measures have been taken against that? Our observers, our monitoring of this, of such places is different from other monitoring, because our task is to ensure minimum rights and to visit as many as possible institutions. So we are not researching or we are not investigating. It's not our task. No, we did not look at that. What do you mean when you are talking about discrimination? Discrimination of who? For example, when they bring children with some disabilities, maybe personnel did something. I will give you an example. We have an orphanage in Kharkiv. Roman Marabyan is the head of it. Roman Marabyan, when Kramatorsk was occupied, agreed with the director of Kramatorsk orphanage and was under the shellings taking children from there to Kharkiv. My question is that discrimination or what? These people are professionals and they do everything to save lives of such children, and I believe in that such case we cannot even talk about any type of discrimination. I will add, it's not about discrimination, but you need to understand there's a personnel, there are managers who have some different positions who are not that heroic. Maybe they want the Donetsk People's Republic or Lugansk People's Republic to be there. They say, we do not want to leave this territory, we want to just have the same budget as we had. Thank you. Unless there are no more questions, I would like to remind you, if you need the photographs, you can come and pick up these photographs from our monitors. Thank you. Experts, we hope that all the plans for evacuation will be